Department, and now we have the opportunity to have Dr. Ricardo with us. He heads Health.ai, the global AI body that's looking at AI governance. Ricardo, thanks for joining us. We'd love to hear your views on digital health sans borders.
Thank you so much for doing that, and it's a real pleasure to be with all of you here today. Once again, thank you for your leadership. It's an exciting time in global health with many challenges, but technology does present many opportunities. And here I think we're focusing more on the bright side of things. You know, since I lead the Global Agency for Responsible AI in Health, which is a nonprofit out of Geneva, we support governments building their governance capabilities so that we can go beyond the pilot stage that many AI tools are at in most health systems around the world towards systemic transformation, towards scaling these technologies so that no one is left behind, leaving equity at the core of our activities. And so to make sure that we are not just benefiting those that are already privileged from the start. And it's interesting that as I travel, I get to meet with several governments, several companies, several stakeholders, and many of them come to us and say, we want to use AI to transform our health systems. And I ask them, why do you want to use AI? The most common answer I get is because their boss is bothering them, that they have to do something with AI, or if they're in government, the minister now thinks AI is the way to go. And that's all good and well, but it's actually the wrong approach. And it's a problem, I would say. And a lot of people are going after these shiny objects, but that is a serious challenge for us in the global health community. We need to make sure that people understand that artificial intelligence and related technologies are enablers for transformation. These are tremendously powerful technologies. They're as good as the data we put into them, and thus the data-first approach is so critical. But also, these technologies are absolutely useless if the people who are leading the implementation stage don't know where they want to go. If you don't know where you want to go, any path will serve. And that is what we're seeing. And it's even worse, I would say. In many contexts, what we're seeing is people using AI tools, and a lot of companies say we use AI because they bought a Copilot, or they bought a $20 subscription to ChatGPT. But what we're seeing is the use of AI to retrofit into our current models of doing things, into our current models of management. So what have our current models of management brought us in healthcare? It's worth that reflection if what we're doing is accelerating the current models of management with the power of AI. Well, the current models of management have failed miserably. What we're seeing globally is a continuous rise of cost in health systems. And one could think, okay, we're spending more money, but at least we're getting better health outcomes. No, we're getting worse health outcomes. Actually, it's quite interesting when you compare outcomes versus cost per capita in health systems. Of course, in very poor countries, if you put a little bit more of money, the outcomes go up. But if you reach Singapore as one of the most effective health systems in the world, from Singapore onwards, all the countries that spend more per capita beyond Singapore, none present better health outcomes. And the country that spends most by far is the United States. So it's actually a plateau that you see in a graph that dips when you reach the US. And why is that? Well, the reason is because our health systems are not health systems. We have disease systems. We have models that react when people get sick. And that system is broken in its essence. And as we are dealing with the issues of longevity, which is a positive consequence of the evolution of science, the truth is we are unable to ensure people living healthy lives as they get older, particularly women. As women are the ones carrying the burden, especially in the last years of life, with worse quality of life. And I'm saying all of this in the context of AI because using AI to perpetuate the current models of care will accelerate these models of care, and this will lead to a complete unsustainability. What we heard from universal health coverage here will become a utopia. if we do not change the way we do business. And so AI represents here an opportunity to be able to take a step back and rethink the way we deliver health and care altogether. You know, today is the first official day of WHA, but we've had multiple side meetings already. In every meeting, I only hear about patients. We have to focus on citizens at large. We need to focus on prevention, on health promotion. And when we fail on preventing and curing diseases, we then have to manage care, especially chronic disease among patients. And the fact that the whole financial incentives are around disease, the fact that disease has become the lucrative part of healthcare is where the problem is. So the issue is, how can we rethink the models of care so that actually prevention makes money? And that's where I think the opportunity lies for AI. We as doctors, I'm a physician in infectious disease by training, when I have a patient in front of me, in reality, when I'm in an institutional health system, I'm looking at 10% of what affects the person's health. They're clinical factors. 30% are affected by genetic factors. 60% are affected by exogenous factors that health systems don't look at. The social determinants of health, the commercial determinants of health, where people live, where the air they breathe, where they work, the education, the water and sanitation they have or don't have access to. All of these issues are critical but excluded from the process. And all of this represents tons and tons, terabytes of data that we are not capable of processing today. And so AI can represent that opportunity for change, for transformation. And we must learn from many of the mistakes, even from the digital health years, where digital health has become a burden in many contexts, where it's the main cause of stress in many health systems for healthcare professionals. And we need to design AI that is embedded in our work, that is user-centric, and that is focused on health outcomes, unlike everything else that we've done until now. One last note to end on trust. Because today, if I have a headache or my son has a fever, I'll take a paracetamol or an aspirin or give a paracetamol to my son. I won't even think twice about it. It's the same for all of us. But if I have cancer, or my mother has cancer, and I go to an AI tool to tell me what is the best combined chemotherapy treatment to treat the specific cancer my mother is dealing with, I don't know if I'm going to trust it. I might second guess it. And this is a reality many healthcare professionals are facing around the world, and citizens and patients. And so, how do we address that issue of trust? How can we reach the level of trust we've reached for medical devices, for pharmaceutical products, when we talk about AI at large? Part of the AI is already covered by medical devices, an important part of the AI is not. We need to create those governance models, because this is a unique sector in healthcare where innovation and governance and regulation have to go hand in hand if we want to scale the technologies for systemic transformation. And so my 10 seconds of publicity is that what HealthAI is doing exactly that, trying to address that challenge, working with government. But we can't do it alone. And the technology is moving so fast, and the ecosystem is moving so fast. So we've created a community of practice that any institution can join. We have 25 governments on board and more than 260 institutions. Feel free to join at our website at healthai.agency, because we need to do this together and we need to create that trust. So, there was a story, one more minute? So, about trust, and I'll end with this, because technology, everything seems very new, but history repeats itself. In the 19th century, people were afraid of using elevators, and I understand them, right? And so they would use elevators for cargo, but not for people. And so an engineer called Elias Otis built a huge elevator with no walls around it in 1853 in Bryant Park in New York City, where the World Fair was taking place. And he built this huge elevator, and you can imagine a huge elevator in the middle, and he had the audience around the elevator. And so one day he had thousands of people around him, and he got on the elevator, and he told his assistant, "Pull me all the way up." And everybody in awe saw him pull him all the way up. And then when he got to the top, he told his assistants, now cut the cable. And the assistant cut the cable, and the elevator dropped a bit, but his proprietary brake system kicked in, and the elevator stopped. And people understood, wow, I can trust this technology. And that became the beginning of use of elevators at scale for humans, and actually became how New York became one of the first cities to start to work on developing skyscrapers that have become a reality in many major cities around the world. Interestingly, beginning of 20th century, we invented a career called the elevator operator, which is someone who would be in the elevator to press the button for us, or use some kind of machine to choose the floor for us, because we wanted a human in the loop, something we talk about in AI. You know how those people lost their jobs? In the 1960s, they thought they were underpaid, they went on strike. And people started using the elevators and they're saying, oh, this works without the operators. I'm not saying we shouldn't go on strikes, that's not the message I want to pass here. What I'm saying is this kind of evolution is normal in technology. The thing is speed. What we're dealing with is an exponential speed which we as humans have a challenge dealing with. We need to make sure that we're using AI to accelerate, but also to make sure that it's provoking the transformation that leads to better health outcomes, and doing so putting equity at the heart of everything we do. The digital divide already exists. With AI, if we are not careful, it can widen that divide. It can be the greatest divider, the greatest equalizer in our time. It depends on us. And that's the exciting part of being at the beginning of this intelligence revolution. And that's why when Rajendra calls me, I come on board and I sign all the declarations he asked me, because we have to do this together. Thank you very much.
So Ricardo has been a great guiding light for the advancements. You know, on the elevator side, I also want to add 30 seconds to a story. Elevators used to take a lot of time to travel up, and people were getting fatigued saying it takes a lot of time. You know what innovation they did? To put mirrors across. So then people were looking at the mirrors and climbing up. It didn't take much worry about that. That's the other fun side.